This is a balanced scorecard briefing for the long-term care setting. Historically, nursing home residents have experienced many poor outcomes, including lower quality of life when compared to elders that reside in the community. In addition, psychological, social, emotional, and physical decline are apparent in the long-term care setting as well. Within healthcare, quality care and safety measures are promoted. Quality assessment planning initiative is a commonly used tool to identify errors in practice and process with the intent of improving care and quality for residents. Although quality care is promoted in long-term care, it has yet to become a part of the culture of the environment. In most long-term care settings, the care that is delivered is poor and contributes to a diminished quality of life. To reflect the organization's vision and strategy, changes in key organizational areas need to be made. These areas include customer service, finances, internal processes, learning, and the community. The purpose of this presentation is to identify a plan in which the objectives of the organization will be met. The result of the developed interventions will be modified appropriately and presented to key stakeholders of the organization. The Balanced Scorecard is a management system that enables organizations to clarify their vision and strategy and translate them into action. When fully deployed, the Balanced Scorecard transforms strategic planning from an academic exercise into the nerve center of an enterprise. A prerequisite for implementing a Balanced Scorecard is a clear understanding of the organization's vision and strategy. The vision statement describes what a company would like to achieve through existence in the future. The vision statement of a premier healthcare, known henceforth as the organization, is to become leaders in the industry in providing quality, person-centered care. The strategy of the organization is to utilize the appropriate resources and operational skills to build and maintain a viable business that addresses the needs of the community and population served. The vision and strategy of the organization impact areas of finance, community, customers, internal operations, and growth. The following slides will detail the recommended changes in the aforementioned areas in order to better reflect the visions of this organization. The first objective is quality care. The Balanced Scorecard considers the needs and perspectives of stakeholders in key operational areas in order to ensure that the vision and strategies are reflected. Quality care is considered from the consumer's perspective. Given the direction that healthcare is moving, quality care is significant in terms of profitability, marketing, competition, and reimbursement. Quality care is influenced by many practices. These include cultural competency, technology, staffing ratios, safety practices, organizational culture, and employee morale. Patient satisfaction has emerged as a central focus of healthcare delivery during the last several years. Nursing care, as a result, has become a significant component in patient satisfaction. Improved healthcare outcomes are achieved when nurses acknowledge the patient's care, values, and preferred care practices and incorporate them into the professional plan of care. Increased patient satisfaction is associated with improved care quality and reduced health disparities. Person-centered care has been widely promoted in long-term care settings. Cultural change models are recommended to establish an environment that is truly patient-centered. The foundation of cultural change is a person-centered philosophy that advocates for choice, dignity, respect, self-determination, and purposeful living of older adults in long-term care facilities. The attributes of the nurse in a patient-centered environment include professional competence, developed interpersonal skills, commitment to the job, demonstrated clarity, beliefs, and values, and a knowledge of one's self. In order to strategically implement the recommended changes to improve quality care, the following are recommended. The utilization of a cultural change model. Current research into the implementation of cultural change models in long-term care demonstrates improved health outcomes for residents receiving care. These models seek to improve the long-term care setting not only through addressing the provision of medical care, but also by altering the environment to create a more humane habitat with pets, plants, and young people. In order to change care quality of this organization to reflect its vision, the utilization of evidence-based practices should be placed into practice. The most important factor in providing the best value-driven care is the implementation of evidence-based practice. Evidence-based practice combines the best available research with clinician experience and patient preference. For quality improvement initiatives to be effective, they should be based on evidence. Without evidence-based practice, clinicians do not know whether the care that they are providing will result in better outcomes. Additionally, they do not know if their interventions are cost-effective. Leaders of the U.S. Department of Health and Human Services urge providers to improve the overall quality of care by making it more patient-centered. The Institute of Medicine and Epstein and Street identified patient-centeredness as one of the areas of improvement in healthcare quality. Patient-centered care can influence patient satisfaction, the quality of healthcare, and the possibility of a patient deciding to return or refer individuals to a provider for services. At this point, the vision and strategy of the organization have been clarified. The next thing to do in improving the care quality is to determine which practices are recommended through research and literature review. This task should take 1 to 3 months. Preliminary benchmarking involves the surveying of customer perception of care quality prior to the implementation of the evidence-based practice. This can be done through the conduction of surveys, monitoring physical decline, and chart review of discharges, complaints, and preventable poor outcomes. Given the fact that some residents in the long-term care setting are nonverbal, it should take approximately 4 months to conduct the appropriate data collection. Implementing the intended plan of correction takes the greatest amount of time. This is comprised of educating clinical staff on the plan and providing the additional support during the early stages. Outcome evaluation is ongoing and fairly simple. Use the same preliminary measures to identify improvements in care quality following the implementation of the new plan, making revisions as necessary, and reevaluate. Communicating with the stakeholders of the company is essential to having the new plan placed into organizational practice. The second objective in this organization is financial stability. The financial perspective emphasizes the stakeholders' concern about how efficient and effective the organization is at utilizing its resources. It measures increases in funding from sources, reductions of costs and risks, and enhanced use of assets. The Congressional Budget Office predicts that Medicare spending for post-acute care will increase from $60 billion in 2013 to $100 billion by 2023. The organization can lower the cost of services by appropriately utilizing resources and participating in research to increase the use of evidence-based practice in the long-term care setting. The Institute for Healthcare Improvement estimates lowering the $1.7 trillion healthcare bill by 15 to 30% through the use of evidence-based practice, medicines, and other efficiencies. A fifth of the U.S. population will be aged 65 to 84 by the year 2050. Adults 85 and older will make up 4% of the U.S. population by that time as well. Although this increase is expected to result in a greater need for long-term care services, many initiatives are currently supporting the use of home-based care as opposed to high-cost facilities. As a result, the organization will benefit greatly in making cultural improvements. These modifications will increase care quality, customer satisfaction, and subsequently customer loyalty. In order to strategically implement changes that will improve the financial stability of the organization, lowering costs and increasing revenue are recommended. Clinical research is the most important aspect of any serious attempt to make changes to the current healthcare system. This organization stands to participate and initiate research that will impact and improve many areas of long-term care. By doing this, they will lower the costs of care services. Fall reduction, pressure ulcer prevention, safety and care quality, as well as staffing, are areas that could stand to be researched in order to make beneficial changes to the long-term care setting. Bed occupancy is indicative of the financial health of an organization. The average bed census ranges from 70 to 83%. This organization has a monthly average census of 64%, which is below the national average. In order to increase revenue, the organization stands to implement measures to improve and market services effectively. In order to improve the financial stability, research is conducted into financial and marketing management recommendations. Additionally, a literature review will be used to identify organizational areas that could benefit from research. This task should take approximately 1 to 3 months. Obtaining financial reports before implementing the evidence-based practice will serve as the baseline. Financial research takes time. It can take over a year to see a return on investment or changes that result from alterations in financial management. Conduct an assessment of financial reports following the implementation of the new plan. The implementation of revisions can take up to an additional 18 months in order to prove the financial benefit. Finally, communicating with key stakeholders takes place, demonstrating the financial benefit for making the changes. It can take these individuals up to 6 months to approve the implementation of these changes into business operations. This is because they have to consider legislative, legal, and political influences. The third objective within the organization is the implementation of evidence-based practice. Evidence-based practice is considered from the learning and growth perspective of the Balanced Scorecard. Evidence-based practice in long-term care setting has been limited. This could easily account for the poor outcomes that plague care recipients in the long-term care setting. The use of evidence-based practice is recommended in order to increase care quality and improve patient outcomes in all areas of healthcare. Technology has brought many improvements to healthcare. It is expected that the largest potential benefit of technology in long-term care is an improved environmental culture. Most current and emerging technologies for the older population are in the concept for test, prototype, and development phase. In order to strategically implement changes that will increase the use of evidence-based practice in the long-term care setting, it is recommended that explaining the relation and relevance of evidence-based practice to employees, conceptualizing a framework, and education is recommended. Advocating for practice change within the organization on the basis that a proposed change will be evidence-based will not be sufficient for change to occur. Evidence can inform practice, but only as a broader factor. People need to know what the benefit is to themselves and what the benefit is to the people that they take care of. This is key in getting them to think differently. Seeing the benefits of change and understanding how actions can have certain consequences influence understanding of whether a change can be made, whether it will make sense, and whether it will work. Conceptual frameworks have been developed to incorporate factors influencing the implementation of evidence-based practice, but those specific to long-term care have been limited. The promotion action on research implementation in health services framework may be useful in aging care. Educating clinical personnel on the anticipated changes in process and in what ways practice will be impacted is helpful in maintaining interest and compliance. Preliminary benchmarking involves the evaluation of past educational experiences and evidence-based practice. This can be attained through surveying clinical professionals at the organization. This may shed some light on the best ways to conduct teaching about the utilization of evidence-based practice. The single most critical element to bringing evidence-based practice to long-term care is compliance amongst clinical staff. Relating the significance of this practice to the clinical benefit of professionals is important in promoting compliance. Implementing evidence-based practice as soon as possible after teaching will help to ensure that learning is retained in clinical professionals. A period of 6 to 8 months, given consistent staffing, is a sufficient amount of time to allow for gatherable data regarding the implementation of evidence-based practice. Evaluate compliance, teaching methods, and care delivery after the implementation of the new plan. Identify improvement and determine areas in which changes in the educational methods can be improved in order to impact patient quality of care. Communicate with stakeholders about the successful implementation of the evidence-based practice in the organization to have revised teaching methods and into organizational practice. Unlike other objectives in this presentation, the intended utilization of evidence-based practice does not require a lengthy wait for a response from the stakeholders. The fourth objective at this organization is the improvement of employee morale. An internal process perspective focuses on the activities that an organization must excel at in order to enhance customer value. Improving employee morale will help to enhance customer value by maximizing the patient experience and satisfaction. Press Ganey's research has identified a direct correlation between employee satisfaction, patient satisfaction, and quality of care. Satisfied employees deliver better care. Working for an organization that values patients and delivers quality care drives employee satisfaction, retention, and loyalty. In addition, continuity of care supports improved patient outcomes. The Institute of Medicine has consistently highlighted the importance of continuity of care for obtaining a high-quality healthcare system in the United States. Growth and learning. Through growth and learning, the organization will implement measures to improve employee satisfaction. The use of a cultural change model may be appropriate in order to help meet this objective. An additional benefit to implementing a cultural change model is that it accomplishes a twofold objective of improved employee morale and increased care quality. The attributes of the nurse in the patient-centered environment include professional competence, developed interpersonal skills, commitment to the job, demonstration of clarity, belief, and values, and knowledge of oneself. In order to strategically implement measures that will result in increased employee morale, the utilization of Press Ganey scores, addressing retention, and implementing a cultural change model is recommended. Many hospitals are using Press Ganey consumer assessment of healthcare providers and systems to assess their patient satisfaction. Measuring nurse engagement is an important factor because high levels of job satisfaction amongst nurses have been linked to high levels of patient satisfaction. Low morale can contribute to negative outcomes at both the patient care and department level. It is recommended that the organization conduct regular staff satisfaction surveys and address findings through staff meetings, salary and benefit improvements, and strategies to resolve other identified issues. Current research into the implementation of a cultural change model in the long-term care demonstrates improved health outcomes for residents receiving care. These models seek to improve the long-term care setting not only through addressing the provision of medical care as previously stated, but also by improving the environment in which the residents reside. Conduct research into methods and evidence-based practices that have been proven to improve employee morale in the long-term care setting. Conduct a survey of morale amongst clinical professionals at the organization prior to the implementation of the intended plan, which will serve as a baseline. The next step is a managerial meeting to identify ways in which the organization can be improved to support employee retention and satisfaction. Over the course of approximately 8 to 10 months, the chosen measures, whether they be cultural change, improvement ratios, increased compensation, or any of these kinds of things, to improve employee morale will be implemented. Ongoing support and communication by leadership is imperative to foster open feedback about the interventions. A post-intervention survey should be conducted to evaluate the impact of the interventions on employee morale. The results of the interventions will then be communicated to stakeholders if they yield favorable results. These interventions will then be placed into routine practice. The fifth objective at this organization is community partnerships. The community perspective of the Balanced Scorecard considers ways in which an institution can engage the community to accomplish and illustrate its vision. Community integration is an important aspect of therapeutic recreation services for many populations. It has been validated as a significant predictor of quality of life for individuals with disabilities. Currently, the organization has very few community partnerships that impact quality of life of its residents. Community Partnerships for Older Adults, with the acronym CPFOA, is a national program funded by the Robert Wood Johnson Foundation to help communities develop leadership, innovative solutions, and options to meet the needs of older adults in long-term care. This program serves as a radical response to the dysfunction of fragmented long-term care services. By building community relationships and maintaining a community presence, the reputation of the organization will improve, provided that these efforts to improve internal influences are ongoing as well. The organization will become resourceful to its current and potential customers, as well as internal influences through building community partnerships. Making appropriate referrals, holding community educational sessions, health fairs, and things of that nature will expound upon the organization's ability to support the community that it serves. In order to strategically implement measures that will result in community partnerships, it is recommended that this organization utilizes approved guidelines and research. In an effort to change the way the communities work by bringing resources and organizations together, models can be used. The CPFOA National Program has guidelines that the organization can use in order to guide the strategic implementation of a plan to build community partnerships. These guidelines support direct involvement of older adults, development of community-supported planning, and mobilization of community resources. Through the development of community partnerships, the organization stands to improve its reputation. This, in turn, will be beneficial in marketing, finance through revenue, and impact healthcare as a whole. In partnering with community providers, the organization will become resourceful to its stakeholders, customers, and the specialty of long-term care. The first step in implementing a plan to become resourceful is research. Through the use of models and planning, the organization will implement ways to connect consumers with stakeholders with the appropriate support to improve quality care and productivity. In order to improve community partnerships, conduct research and a literature review into the supported recommendations. This task should take approximately 1 month. Community partnerships will impact care and finances within the organization. Conduct audits and obtain financial reports before the implementation of methods to increase community partnerships. This will serve as the baseline. As previously mentioned, financial assessments can take longer to demonstrate a return on investment. It can take over a year to receive a return on investment or changes that result from alterations in financial management. Conduct an assessment of finances and care quality following the implementation of a new plan to evaluate the outcomes. The implementation of revisions can take up to an additional 18 months in order to prove financial benefit. Communicate with key stakeholders to demonstrate the benefits for making the intended plan a part of the organizational culture. This evaluation criteria is applicable to any of these 5 objectives within this organization. The Quality Improvement Project examines an organization's weaknesses and ways in which to improve them. This encompasses research, gathering organizational data, and evaluating interventions following change. The goals of this organization can be analyzed using a quality improvement project. In order to facilitate the appropriate evaluation of any of the goals of this organization, the following practices can be utilized. Clinical audits will reveal differences in pre- and post-intervention outcomes. This, in turn, will conclude how successful the planning and intervention was in meeting the goal. Clinical audits can be applied to all of the goals of this organization. The framework for improvement is the process by which the change will be implemented. In all of these goals, a framework approach is utilized to guide the needs assessment, research, implementation, and evaluation. Reviewing practice is useful in evaluating change. By reviewing practice, organizations are able to identify areas in which improvements can be made. It is pertinent to the Balanced Scorecard as it supports the intended practice changes that are necessary to meet the organizational goals. In efforts to implement improvements in care, the revision of interventions may be necessary. The utilization of data analysis will help to identify how well the objectives were met. The basis for plan revision lies in the identification of weaknesses and areas of improvement. Redevelopment and reimplementation of interventions may be necessary in order to obtain desirable outcomes. Reevaluate new implementations to determine their ability to meet the objectives of the organization. There are many styles of communication that can be used in order to deliver a plan of change. To communicate this intended plan of care for older adults, framing the message and increasing the ability to use and apply evidence are the communication styles that will be discussed. In using these 2 methods of communication, learners will be able to identify and apply the purpose and necessity for the implementation of any of these interventions in order to meet the goals of the organization. Framing the message is a method of communication that conveys the same message in multiple ways. Increasing the ability to use and apply evidence is a style of communication that provides resources to support the plan. This method of communication encourages the integration of evidence-based practices, which in this case will result in positive patient outcomes and high-quality care. The combined use of these communication styles will contribute to effectively communicating the intended plan of care. Effective communication contributes to nurses' commitment to the change process. Commitment to change can either be positive or negative. Positive commitment occurs when clinicians view the importance of change and are committed to the change process. To overcome the barrier of communication, the importance of limiting unfamiliar or discipline-specific terminology and acronyms must be stressed. The ability to speak in a casual manner in the interdisciplinary setting will make communication with patients and families more effective. Casual speaking also makes it easier for multidisciplinary clinicians, when learning, to understand and apply the information being taught to their specific discipline. Through limiting the use of specific discipline language, learners will value the information that is being provided in order to modify the way that they deliver care. Open communication will be encouraged amongst clinicians. Collaboration will take place with educators to provide an environment that fosters teamwork and adaptation to the intended plan. The Balanced Scorecard is an effective tool for goal setting and accomplishing goals within organizations. It helps to establish congruency between the organization's vision and influences of customers, finances, internal operations, learning, and the community. The plan for communicating the outcomes to a diverse group of stakeholders and constituents will help to ensure that all pertinent information regarding the implementation of this plan is delivered and interpreted correctly. As it relates to the long-term care setting, this balanced scorecard will prove to demonstrate the need for change, plan for change, and outcomes for change as intended.